Part 1. The foundation of intimacy isn't touch, it's trust. What if the most intimate thing you could offer your partner wasn't your body, but your attention? In a world filled with noise and pressure, even in the quiet of our later years, real intimacy isn't about what you do, but how deeply you're willing to see, hear, and honor another human being. I'm Dr. James Rowen, a urologist who has spent decades working with men, navigating intimacy, aging, and reconnection. And today, I want to speak to the man who's wondering, is it too late to rekindle what we once had? Let me say this clearly. It's not too late, and this conversation is for you. Before we talk about where to touch or where not to, we need to talk about something even more important: how to touch the heart. Because no amount of technique can make up for a lack of trust. If your partner doesn't feel emotionally safe, no physical gesture, no matter how gentle, will feel welcome. As we grow older, the needs of the body shift, but the need to feel cherished remains the same. She still wants to feel adored. She still wants to be chosen, noticed, held. But the path to that now requires more listening than leading, more presence than performance. So I invite you, slow down. Sit beside her, not just physically, but emotionally. Start with your words. Start with your eyes. Let her know that you're not here to fix anything. You're here to understand her again. Because when a woman feels deeply understood, her whole body responds differently. Walls fall, breath softens, trust grows, and that's when touch becomes sacred again. If this message speaks to your heart, I encourage you to subscribe to this channel. We're building a space for men over 60 who want real connection, not just information, but transformation. Every week, I'll share new guidance to help you deepen intimacy, restore confidence, and reclaim the tenderness that still lives within you. Your journey starts now, and you don't have to walk it alone. Shall we begin? Part 2. The first touch. What every man should know about the vaginal entrance and its surroundings. For many men, physical intimacy is an act of love, desire, and devotion. But when it comes to a woman's body, especially as both partners age, intention is not enough. Understanding is essential. And among the most misunderstood areas is the entrance of the vagina. Contrary to common belief, this is not a region to be approached with immediate enthusiasm or assumption. The vaginal opening, also known as the introitus, is a sensitive, complex area. With age, hormonal changes like declining estrogen can lead to thinning tissues, dryness, and increased sensitivity or even pain in this region. For a woman who once enjoyed stimulation here, the experience may now feel drastically different. This is not a sign of rejection or failure. It is biology, and your role is not to rush in, but to become a student of change of her change. The outer vulva, including the labia and vaginal opening, can still be a source of gentle pleasure, but it requires patience, moisture, and most importantly, emotional presence. If you approach this area like it's a switch to be flipped, she may instinctively pull away. But if you approach with reverence, slow hands, and attentive eyes, her body will often respond in its own time. Let me be clear, stimulation here must never begin without context. Start by holding her close. Let your hands rest on her back, her neck, her hips. Let your words do their work before your fingers arrive. And when you do touch near the entrance, do so without expectation. A soft caress, not direct pressure, allows her nervous system to feel safe. Lubrication is not optional at this stage in life. Whether natural or added with a trusted product, it reduces friction and enhances comfort. But even with lubrication, technique matters. Circular motions, outer tracing, gentle breath on the skin, these matter more than any textbook maneuver. And always ask. Ask with your voice, ask with your eyes, ask with your pauses. Is this okay? Can be the most erotic question you ask when it's asked with tenderness and humility. It's also important to understand that a woman's readiness is not just physical. If she is distracted, emotionally distant, or feeling unsafe, even the lightest touch may feel intrusive. So make sure the moment is right, not just for you, but for her. When you meet the entrance of her body with the respect it deserves, she may welcome you not only physically, but emotionally. That is the gateway to real intimacy. Not just sex, but closeness and connection. In the next part, we'll explore an even more delicate area, the space surrounding the urethral opening and why it often requires even greater care. Part 3. The quiet zone. Understanding the area around the urethral opening. There are places on a woman's body that have been deeply misunderstood, misrepresented, or simply ignored. One of them is the area surrounding the urethral opening, a small, sensitive zone located just above the vaginal entrance. For many women, this area is neutral, unremarkable. But for others, it can be intensely uncomfortable if touched carelessly. And as a urologist, I've seen how often it becomes a site of confusion or even unintentional pain. Let me be honest with you. The area around the urethra is not a place to experiment unless you've both had a conversation and built the trust. To do so, unlike the clitoris or the inner vaginal walls, this space is rarely a source of pleasure and is often associated with vulnerability. The urethra, after all, is not a sexual organ, it is a passage for urine, and stimulation here, especially with too much pressure or too little awareness, can feel intrusive, or worse, can cause infection or irritation. I have counseled many older couples where a well-meaning partner, hoping to explore and excite, accidentally triggered burning, discomfort, or even a urinary tract infection by focusing attention in this area. The intentions were good. The understanding was not complete. The skin here is thin. The mucosal tissue is sensitive. And in postmenopausal women, the tissue becomes even more fragile due to estrogen loss. There's often less natural lubrication, less resilience, more vulnerability. That doesn't mean this area must be avoided entirely, but it means you must approach with extreme gentleness. And even more importantly, with permission. If you are exploring touch in the vulvar area, consider mapping it with her. Use your words. Is this too close? How does this feel? Give her the space to say no, or not there, or maybe try somewhere else. These moments don't break intimacy, they strengthen it, because what you are building is not just a sexual connection, but a culture of safety and deep listening. And if she tells you that this area doesn't feel good, believe her. Don't try to change her mind with technique or persistence. Simply move on. The human body has many doors. Not all of them lead where you want to go. But honoring the ones that remain closed makes the ones that open feel that much more sacred. Touch is powerful, but restraint is just as powerful. Knowing where not to touch is part of becoming a wise, attuned lover. And in this stage of life, wisdom is what your partner truly needs. In the next part, we'll explore the inner vaginal wall, more complex and often misunderstood region that, when approached properly, can become a place of deep pleasure and connection. Part 4. The inner vaginal wall, a place of mystery, memory, and meaning for many couples, especially those who have been together for decades. The idea of exploring the inner vaginal wall feels familiar, perhaps even routine. But as we age, what once felt natural can begin to feel foreign, and what once brought pleasure can now bring discomfort or emotional distance. Let me be very clear. The inner vaginal wall is not simply a place. It is an experience. And how that experience unfolds depends as much on emotional safety and preparation as it does on biology. Anatomically, the vaginal canal is a muscular structure capable of both expansion and deep responsiveness. With sufficient arousal and trust, it becomes richly engorged, warm, and receptive. But in the absence of these, especially in postmenopausal women, the inner wall may feel dry, thin, or even painful when touched. This isn't her fault, and it's not yours either. It's nature, it's aging, and it's a call to evolve the way you love. Many men rush this part believing that deeper penetration or more stimulation will lead to more pleasure. But in reality, the inner vaginal wall requires time, not just time in the moment, but time in the relationship, emotional foreplay, days of kindness, hours of connection, minutes of mindful touch. You must earn your way inward, not claim it as entitlement. Start by focusing outside. Breathe with her, hold her gaze, let your presence be the invitation. Let her body open because she wants you there, not because you tried to get there. When you do begin touching the inner wall, whether with fingers, a toy, or during intercourse, use extreme gentleness. This isn't a place to perform, it's a place to attune. Press too firmly, and the moment is lost. Go too quickly, and the door shuts. Ask her what she feels. Listen to what she says and doesn't say. Sometimes silence isn't consent, it's confusion, or discomfort, or fear of disappointing you. And if she responds positively, stay present. Keep checking in. Don't chase climax, chase connection. Because at this age, connection is the climax. You may be surprised. The GS spot, often spoken of but rarely understood, is simply part of this inner wall, and it is not a button. It is a landscape, one that responds to consistent, respectful exploration, not aggressive seeking. To be allowed into this sacred space, especially after years of pain, loss, or silence, is an honor. Treat it that way. And you may find that, even at 70 or 80, a woman's body can still teach you something new about tenderness, trust, and love. In the next part, we'll approach an even more controversial subject. The anosa region, filled with myths, caution, and unexpected truth. Part 5. The anosics, exploring the most misunderstood region with reverence and consent among all the areas. On a woman's body, perhaps none is more surrounded by misunderstanding, taboo, or hesitation than the anus. For some, it is a line not to be crossed. For others, it is an untapped source of intimacy. But for all, it is a region that demands the highest level of communication, caution, and care. Let's begin with the basics. The anus is not designed for sexual penetration in the same way the vagina is. Its tissue is thinner, more vulnerable to tearing, and it lacks the self-lubricating properties of vaginal mucosa. As a urologist, I've seen the consequences of uneducated exploration, pain, trauma, and long-term distrust between partners. But I've also seen, in the context of loving, informed relationships, how this area can be embraced safely and respectfully. So, should it be touched? That is not a medical question, it is a relational one, and the answer depends not on your curiosity or your desire, but on her voice. If your partner has never expressed interest in this area, or has previously shown discomfort when touched nearby, then the matter is settled. This is a place to be left alone. You honor her boundaries not because you're afraid of her reaction, but because you respect her personhood. But if the topic has surfaced perhaps gently in conversation, or subtly through response, then there is room to explore. Slowly, gently, openly, and always with enthusiastic consent. If you reach the point where you and your partner have agreed to explore this area, here are some truths you must know. Hygiene is non-negotiable. Cleanliness, trimmed nails, and the use of gloves or protection are essential. Lubrication is mandatory. Even external touch must be accompanied by a high-quality, body-safe lubricant. Pressure must be minimal. There are more nerve endings here than you think, and the body's initial reaction may be tension, not relaxation. Stop means stop. There can be no negotiation in the moment. Any hesitation is your cue to pause, reflect, and regroup. But perhaps most importantly, understand that this region, more than almost any other, carries emotional associations: shame, fear, curiosity, trauma. For some women, especially those with past sexual trauma or cultural taboos, even the mention of this area can trigger discomfort. If this is the case, let your love speak by stepping back, not forward. And if she allows you in, not just physically, but emotionally, cherish that trust. You are not conquering a body. You are being invited into a sacred space. Handle it with dignity. Remember, real intimacy is never about crossing lines. It's about recognizing the lines and only stepping forward when you're truly welcome. In the next part, we'll enter the deepest part of the female anatomy, the cervix, a region of complexity, emotion, and profound vulnerability. Part 6. The cervix, where the body meets the lifter, is one part of a woman's anatomy that is truly cloaked in mystery even for longtime partners. It is the cervix. Nestled at the deepest point of the vaginal canal, the cervix is more than a biological gateway. For many women, it is a threshold of emotional memory, vulnerability, and, at times, pain. As a urologist, I've spoken with countless men who simply didn't know what the cervix was, or worse, didn't realize when they had touched it. Some believed that deeper must be better. Others assumed discomfort was simply a natural part of aging. But the truth is this: the cervix is not a place for casual contact. It is a place that demands reverence. Biologically, the cervix is the lower part of the uterus, and during arousal, it can lift and move slightly, making deeper penetration more comfortable. However, in many women, especially postmenopausal women, the cervix can become more sensitive, less mobile, and less resilient. Hormonal changes reduce cervical elasticity. Past childbirth, trauma, or surgeries can make it feel raw or even unreachable in any comforting way. This is why I always tell men, depth is not your destination. Connection is. When you or your partner feel that your bodies are drawing closer, take it slowly. If you do reach the cervix, her body will tell you long before she does with words. She may tense, pull away, hold her breath, or her eyes may change. Learn these signals. Listen with your entire presence. If she does enjoy stimulation near the cervix, and yes, some women do, it will never come from sudden, forceful thrusts. It comes from the slow build of trust, arousal, and attunement. Even then, pressure must be felt. Think of it not as pushing, but as breathing near the edge of a cliff, aware of the depth, but careful not to fall. Some women may have experienced medical trauma involving their cervix: pap smears, biopsies, IUD insertions, or even childbirth complications. These memories are stored not just in the mind, but in the body. So when you approach the cervix, you may also be approaching years of silent pain. Let your hands speak what your voice must also say. I'm here, I'm listening, you're safe. And if her cervix is not open to touching her that boundary fully, intimacy isn't about reaching every part of the body. It's about being welcomed wherever love is allowed to go. In our next section, we move upward to a place often underestimated in its erotic power, the nipples. Certainly. Here is part 7 of the article. Part 7. The nipples, where tenderness awakens desire in the quiet architecture of intimacy. Some of the most powerful doors are not hidden there, simply overlooked. The nipples are one such door. Gentle, accessible, and often underestimated, this region holds deep potential for connection, arousal, and emotional resonance, especially in women over 60. As a urologist, I've often seen male patients who focus all of their attention on genital regions, believing that sexual pleasure is a linear path: foreplay to penetration, climax to closure. But the truth is far more intricate and far more beautiful. For many women, especially those in long-term relationships or rediscovering intimacy in later life, the nipples are not a warm-up, they are a destination. Neurologically, the nipples are connected to the same brain region as the clitoris, vagina, and cervix. This means that nipple stimulation can create similar feelings of arousal and emotional openness. But unlike deeper or more intimate zones, the nipples offer a unique blend of accessibility and vulnerability. They are right, they're visible, touchable, but they still require reverence. The way you approach them says everything about who you are in that moment. Are you rushing? Are you distracted? Are you treating her body like a checklist or, like a sacred map, you're still learning to read? Start slowly, with your eyes, with your breath. Don't make the first contact with your fingers, make it with your attention. Then, let your touch be light, exploratory, and patient. For some women, even the surrounding skin, the upper chest, the curve of the breastie is more erotic than the nipple itself. And just as important, ask, does this feel good? Do you want more? These are not interruptions, they are invitations. Every question is a moment of trust. Every pause is a chance to listen not only to her body, but to her emotions. Be aware, too, that sensitivity varies. Some women may feel electric pleasure from the slightest touch. Others may have little sensation at all, especially after childbirth, surgery, or aging. And still others may carry hidden discomfort memories of being objectified, judged, or ignored. Your tenderness is the antidote to that history. You don't need to stimulate nipples as a means to an end. Sometimes, resting your hand gently over her heart, literally feeling her heartbeat, can be more intimate than any sexual act. Because what the nipples truly respond to is not pressure, but presence. In the final section, we'll explore how to bring all of this together, the emotional, the physical, the spiritual. It's a reminder to all men who still long for connection that love doesn't fade with age, it deepens. Part 8. A gentle reminder it's never too late to be loved, or to love deeply. If you've made it this far with me, it means something important. You care. You care enough to listen, to learn, and to show up differently for your partner, and for yourself. That alone makes you a rare kind of man. In the hundreds of conversations I've had with elderly couples, there is always a moment when the man leans forward and asks, often in a whisper, do you think she still wants me? It's not about sex, it's about presence, about being seen, about knowing that, even now, he still matters. And here is what I want every man to hear. Yes, she does. But not in the way you used to imagine. She doesn't want you to perform. She doesn't want you to prove anything. She wants you to be with her, emotionally available, physically present, spiritually awake. At this stage in life, intimacy is less about conquest and more about communion. The truth is, intimacy after 60 or 70 or 80 isn't about getting everything right. It's about having the courage to keep showing up, to ask new questions, to touch with humility, to apologize when you misread her, to stay curious even after decades together, to realize that love, like the human body, changes but never stops needing to be held. So, where do you go from here? Start with presence. Be with her without distractions. Look into her eyes like she's still the most fascinating woman you've ever met. Touch her with hands that listen. And ask not just what she wants, but how she's feeling, what she's afraid of, what she's dreaming of now. And take care of your own body. 2. Get sleep. Eat foods that fuel your blood flow and mood. Move your body. Get checkups. You can't be there for her if you're not taking care of you. If you're single and reading this, know that it's not too late for you either. Many men find love again in their 60s and 70s, not because they're chasing youth, but because they've finally become the kind of partner who understands what intimacy really means. So here is my final advice. As a urologist, a husband, and a man who has witnessed thousands of love stories unfold and be reborn, be slow, be kind, be curious, be honest, but above all, remember, your ability to love didn't age. It just matured. Final words. Let this be a new beginning. If you've made it to the end of this journey, I want you to pause for a moment, not to reflect on what you've read, but on who you are becoming. You are the kind of man who dares to love more gently, who seeks knowledge not to control, but to connect, who sees aging not as a fading light, but as a softer flame, one that still warms, still glows, still burns with meaning. And for that, I honor you. In a world that often tells men to stay strong, silent, and stoic, you've chosen a different path, a path of wisdom, compassion, and reconnection. You've chosen to be present, and that choice changes everything. Whether you've been with your partner for 40 years, or you're opening your heart again after loss, divorce, or time alone, please know this: it's never too late to be tender, never too late to listen, never too late to love. And if this message resonated with you, I warmly invite you to stay connected. Subscribe to this channel for more heartfelt, science-based guidance on intimacy, aging, and health for men over 60. Each week I'll share conversations that matter about the body, the heart, and the invisible threads that keep love alive. This isn't just about information, it's about transformation together. Leave a comment, share your thoughts, let us know how you're feeling. Because you're not alone in this journey, and your voice might be exactly what someone else needs to hear. Until then, take care of your body, tend to your spirit, and remember, the greatest intimacy doesn't begin in the bedroom. It begins in the way you choose to show up with kindness, with courage, and with love.